Opis Senior Services Group presents Agency Training. Opis Senior Services Group is dedicated to the highest standards of care for all those we serve, our customers, their families, and each other. By listening to our customers, our caring and compassionate team members are continuously improving operations and creating a warm, respectful, dignified, ethical, and safe environment for the elderly we serve. As our CEO, Marilyn Wood, states, we had a dream to create a culture that could make a difference in long-term care. So our mission is composed of words that are reflective of how we carry out our business every day. Having a mission-driven organization is not just words on a piece of paper. It has to be incorporated into everything that we do. The mission of Opis is to make people happy, comfortable, and well cared for. To have everybody in the organization working off the same platform really makes a difference. So we use our mission as a way to move everyone in the same direction with a single focus. The meaning of customer. We refer to our patients or residents as customers to remind ourselves that they have a choice of where to go for services. It is up to us to meet their expectations, not just for clinical care, but as individuals. We believe that we should treat and talk to all of our customers in the exact same way that we would want to be treated when dealing with an organization that provides services to us. Opis is dedicated to listening to elders and their family members in an effort to best meet their needs. We also believe that the word resident has a passive quality to it, whereas customer requires us to be attentive to the people we serve. As we move forward within the pandemic, it is very important that we are all intimately familiar with the way this virus is spread. So what is coronavirus? Coronavirus, COVID-19, is an illness caused by a virus that can spread from person to person. COVID-19 symptoms can range from mild or no symptoms to severe illness. What are the symptoms of COVID-19? Symptoms may appear 2 to 14 days after exposure to the virus. These can include a fever of 100.4 or higher, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, diarrhea, nausea, or vomiting. If you have a fever and/or any of the above symptoms, be sure to call your supervisor and do not come into the center. If you develop symptoms while in the center, notify the supervisor and make arrangements to leave the center. How is COVID-19 spread? You can become infected by coming in close contact, about 6 feet or 2 arm lengths, with the person who has COVID-19. COVID-19 is primarily spread from person to person. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. This is why a face mask and face shield is your best protection. You may also be able to get it by touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes. Screening processes are in place for your protection. The purpose of the screening is to prevent anyone who has symptoms of COVID or who has had potential exposure to someone with COVID from entering the building. First and foremost, we must maintain social distancing while waiting to be screened. All team members must wear a mask prior to entering the building, then don a face shield before leaving the screening area. Unopened water bottles, unopened cans, coffee cups, or reusable drink cups are okay as long as the exterior can be disinfected. Paper or foam disposable cups are not allowed. Phones are disinfected by using alcohol wipes or pads. Apple and Samsung endorse this as a cleaning method for phones. Personal bags are discouraged at all times, but if you must bring a bag, you must disinfect the exterior with an EPA-approved disinfectant upon entry. The decontamination process includes these steps. Wash your hands upon exit of the unit or building. Go straight home. It is recommended that you do not stop at the grocery store, gas station, etc. Remove shoes, preferably before entry into car. Change into flip-flops, slippers, etc. If that is not possible, remove shoes in the garage prior to entry into your home or immediately inside the door, but prior to walking through your home. Immediately remove soiled work clothing and preferably place directly into a washer or into a disposable or washable bag. Shower before touching anything or any other household member after working. Wash your uniform or clothing in soapy water at the highest temperature possible. We encourage use of cloth masks when out in public. Practice social distancing and use frequent hand hygiene. Infection control. Standard precautions consist of the following practices: hand hygiene before and after all customer contact, use of personal protective equipment or PPE, which may include gloves, fluid impermeable gowns or plastic aprons, masks, face shields, and eye protection. Ensure that customers are wearing masks when leaving their rooms. Ensure customers' faces are covered with either a mask, tissue, cloth, sheet, etc. when performing care that requires you to be within 6 feet of them. With cough etiquette, cover your mouth and nose with tissues or cough or sneeze into your elbow area. Perform hand hygiene after sneezing and/or coughing. Transmission-based precautions. Contact precautions are used for infections, diseases, or germs that are spread by touching the patient or items in the room, for example, MRSA, VRE, diarrheal illnesses, open wounds, RSV. Potential PPE needed for contact precautions include gloves and gowns. Droplet precautions are necessary when a patient is infected with a pathogen, such as influenza, and the caregiver is within 3 to 6 feet of the patient. Infections are transmittable through air droplets by coughing, sneezing, talking, and close contact with an infected patient's breathing. Potential PPE needed for droplet precautions include gloves, gowns, face masks, and a face shield or goggles. Airborne precautions are required to protect against airborne transmission of infectious agents. Diseases requiring airborne precautions include, but are not limited to, measles, severe acute respiratory syndrome, SARS, varicella, chickenpox, and mycobacterium tuberculosis. Potential PPE needed for airborne precautions include gloves, gowns, N95 or greater masks, and face shield or goggles. Hand hygiene continues to be the primary means of preventing the transmission of infection. When using hand sanitizer or alcohol-based hand rub, use enough, which is usually about 2 pumps, to ensure hands remain wet for 20 seconds of rubbing and friction. When performing hand hygiene with soap and water, wet hands, add soap, lather and use friction to rub hands together. This should occur for a minimum of 20 seconds. Tip, sing happy birthday twice or the ABCs twice. Rinse and dry with paper towels. Get a clean paper towel to turn off the faucet. Hand hygiene should occur a minimum of 4 times during each interaction with a customer. Hand hygiene before entering into a room, ensuring hands start clean. Hand hygiene again once in the room before beginning care. Hand hygiene when finished before leaving the room, even if you haven't touched the customer. Hand hygiene after leaving the room. Personal protective equipment is protective clothing, helmets, goggles, or other garments or equipment designed to protect the wearer's body from injury or infection. Donning and doffing PPE and appropriate and effective use of PPE. Face masks and eye protection, including goggles and face shields, will be applied first during COVID-19. The usual donning order includes gowns, face masks, face shields or goggles, then gloves. The usual doffing order includes gowns and sleeves, gloves, and we're currently not removing our face masks and shields. When using the plastic gowns and sleeves, they'll be removed by tearing down the front of the gown and not by pulling over the head. Sleeves will be removed after the gown. Contact and droplet precautions are to be utilized with COVID-19. Ensure that alcohol-based hand rub is accessible. It needs to be 60% alcohol strength or higher. PPE carts should be strategically placed in each hallway to ensure easy access to PPE. When it comes to documentation, ensure to sign the log in each customer's room. This assists us with COVID-19 contact tracing should there be a positive case of COVID-19 identified. Q shift monitoring should be completed by each nurse. This is a systematic review of all the body's physiological systems. The Q shift monitoring UDA is located within PCC, point-click care, the electronic medical record. This is the best way to identify early signs of condition change. It is important to complete all sections of the UDA. Vital signs must be taken by the nurse and documented every shift by the nurse. It is important to document the particulars or changes in vital signs. For the 11 to 7 shift, take the vital signs early in the morning, just before the end of the shift. This will assist to ensure that we do not wake customers in the middle of the shift. With non-disposable equipment, lifts and slings will be cleaned and disinfected with a dispatch wipe and covered with a plastic bag between uses. Be sure to bag slings separate of the lift and ensure that the slings do not touch the floor. Between use of scales, disinfect the seat of the scale with a dispatch wipe and cover with a plastic bag. Take care not to use dispatch wipes on the digital screen of the scale. The glucometer will be disinfected with dispatch between every customer. Wipe for 1 minute or 3 minutes with C. diff and allow to air dry. Blood pressure cuffs and stethoscopes will be disinfected with a dispatch wipe and covered with a plastic bag between uses. The crash cart will be cleaned with an EPA-approved disinfectant after use and covered with a mesh or plastic cover. Necessary cleaning supplies are readily available for team member use and safely stored when not needed. When it comes to the expectation of nursing team members, we are responsible for 24-hour continuous care for our customers. This includes breaks. When a team member goes on break, it is the responsibility of the covering CNA to provide for the needs of the customers during that time, even those who are unable to put the call light on and ask for assistance. Be sure you let the nurse and covering CNA know when you leave that unit for any reason. When a CNA is not available for some reason, the licensed nurse on that assignment is still responsible for the overall care of that customer, either delegating care to someone else or covering for that customer him or herself. In order to maintain the highest standards of care for all those we serve, our approach to care and assignments should be proactive instead of reactive so that customer care is adequately provided. The care plan and CardX within POC, point of care, and PCC, point-click care, is the information source for team members to know how to care for the customer. Any new behaviors that are observed during the course of care should always be reported to the nurse. Individual care interventions can be updated as necessary and will be available to all caregivers when dealing with resistive behaviors. Any situation where a team member is frustrated to the point of behaving inappropriately or losing it should always involve getting assistance or removing yourself from the situation until you are able to calmly deal with those behaviors. Nurses should report any change of condition of the customer to the APRN or physician, and it will be documented in the medical record. Coaching is a way to give positive or constructive feedback that assists to improve performance. We want everyone to feel the personal responsibility and confidence to coach when the opportunity presents itself. No one is excused from improving their performance. Coaching helps everyone tie what we do every day to the Opis mission and improve customer satisfaction. Here at Opis, we coach up, down, and sideways. When it comes to HIPAA, confidentiality refers to an individual's personal information shared to authorized individuals that cannot be divulged to third parties without the consent of that particular individual. PHI, or protected health information, is any personally identifiable data such as names, date of birth, phone records, billing records, lab tests, diagnostic results, etc. Examples of safeguards that protect PHI are passwords, firewalls, encryption of devices, storage of electronic devices, etc. Do not dispose of papers, medication packets, etc. that contain customer information in the trash can. Place in locked shred boxes instead. Sharing of any customer identifiable information, pictures via social media or electronic devices, is a breach of confidential protected information. Do not take pictures of customers. Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. Abuse also includes the deprivation by an individual, including a caretaker, of goods or services that are necessary to attain or maintain physical, mental, and psychosocial well-being. Instances of abuse of all residents, irrespective of any mental or physical condition, cause physical harm, pain, or mental anguish. It includes verbal abuse, sexual abuse, physical abuse, and mental abuse, including abuse facilitated or enabled through the use of technology. Willful, as used in this definition of abuse, means the individual must have acted deliberately, not that the individual must have intended to inflict injury or harm. Physical abuse is any activity that includes, but is not limited to, hitting, slapping, pinching, or kicking. It also includes controlling behavior through corporal punishment. Verbal abuse is any use of oral, written, or gestured language that willfully includes disparaging or derogatory terms toward customers or their families, or within hearing distance, regardless of their age, their ability to comprehend, or disability. Sexual abuse is non-consensual contact of any type with a customer. Mistreatment means inappropriate treatment or exploitation of a customer. Mental abuse includes, but is not limited to, humiliation, harassment, threats of punishment, or deprivation. Mental abuse may occur through either verbal or nonverbal conduct, which causes or has the potential to cause the resident to experience humiliation, intimidation, fear, shame, agitation, or degradation. Neglect is the failure of the service location and its team members to provide goods and services necessary to avoid physical harm, mental anguish, or emotional distress. Exploitation means taking advantage of a customer for personal gain using manipulation, intimidation, threats, or coercion. Involuntary seclusion is separating a customer from other customers or confinement to his or her room with or without roommates against the customer's will or the will of the customer's representative. Misappropriation of property is the deliberate misplacement, exploitation, or wrongful temporary or permanent use of a customer's belongings or money without the customer's consent. Injuries of unknown source. An injury should be classified as an injury of unknown source when both the following conditions are met. The source of the injury was not observed by any person, or the source of the injury could not be explained by the resident, and the injury is suspicious because of the extent of the injury or the location of the injury. For example, the injury is located in an area not generally vulnerable to trauma, or the number of injuries observed at one particular point in time, or the incidence of injuries over time. Serious bodily injury includes, but is not limited to, an injury involving extreme physical pain, substantial risk of death, protracted loss or impairment of the bodily member, organ, or mental faculty, sexual abuse, or requiring medical intervention such as surgery, hospitalization, or physical rehabilitation. Elopement occurs when a resident leaves the premises or a safe area without authorization, such as an order for discharge or leave of absence, and/or any necessary supervision to do so. The elopement announcement is code silver in the customer's name, and that will be repeated 3 times. The code silver announcement signifies to team members the need to begin searching their assignments, that all customers are present and accounted for, and for those that are assigned to report to the conference room for their search assignments. Please note, if team members suspect a missing customer but are not sure of the customer's name, the code silver check your assignments announcement should still be initiated. The administrator and DON should be notified immediately. In an active shooter event, early and immediate recognition and announcement is very important to increase your chance of survival. The announcement used for an active shooter is Active shooter in announced location. Proceed with center lockdown process. This will be announced 3 times. In a fire situation, Opis uses the announcement code red, fire, or zone location. This will be announced 3 times. CNAs will have been assigned to the fire brigade. They will know if they are on the brigade by looking at the assignment sheet when they come to work. Those who are on the fire brigade will safely but quickly grab a fire extinguisher and get to the location of the fire. Those who are not on the fire brigade will assist in preparing the center. Do not go through any of the fire doors once they have closed. Move customers into their rooms. Clear everything out of the hallways. Wait for further instructions and help customers and family members to stay calm. Fire emergency procedures remain in place until the all clear is announced. When a fire is identified, we use the acronym RACE: Rescue, Alarm, Contain, Extinguish, or Evacuate. When using a fire extinguisher, we use the acronym PASS: Pull the pin, aim at the base of the fire, squeeze the handle, sweep the nozzle from side to side. For a cardiac or respiratory emergency, the crash cart and nurses are needed immediately at the announced location. We use the announcement code green with the location or room. This will be announced 3 times. When you hear this announcement, you should stop what you're doing and respond. Retrieve the crash cart and proceed to the announced location. If they're a customer, check the paper chart for DNR paperwork. CPR can be initiated if not a DNR. If not a customer, for example, a team member, visitor, etc., CPR can be initiated by anyone trained in CPR. This is covered by the Good Samaritan law. Our center encourages all customers to observe their right to voice concerns, grievances, and offer suggestions at any time. They may present a grievance orally or in writing. Grievance forms are located in the social services office at each nurse's station. A grievance form may be completed for any concern and given to any team member. Any team member can assist the customer in completing a grievance form, but the grievance officer, the administrator, is responsible for implementing the grievance process. Anonymous grievances can be filed with the grievance officer or designee, who will keep your identity confidential while working towards a resolution. Grievances are addressed with department managers and the administrator by social services on a daily basis until they're resolved. The center will follow up with concerned parties in a reasonable time frame, and all attempts will be made to resolve promptly within 7 business days. If requested, a written resolution of the grievance and/or grievance policy will be given. Customer rights. The customer has the right to exercise his or her rights as a customer of the facility and as a citizen or customer of the United States. To be informed of and participate in his or her treatment, to refuse medication, to choose his or her attending physician, to be treated with respect and dignity, to voice grievances to the facility or other agency or entity that hears grievances without discrimination or reprisal. To be informed of his or her rights and of all rules and regulations governing customer conduct and responsibilities during his or her stay in the facility. To access personal and medical records pertaining to him or herself. To send and receive mail, receive letters, packages, and other materials delivered to the facility for the customer through a means other than the postal service. To a safe, clean, comfortable, and home-like environment, including but not limited to receiving treatment and supports for daily living safely, and are allowed to use their personal belongings to the extent possible. To personal privacy and confidentiality of his or her personal and medical records. The customer will have the right, subject to his or her consent, to receive the visitors whom he or she designates, including but not limited to a spouse, including a same-sex spouse, a domestic partner, including a same-sex domestic partner, another family member, or a friend, and his or her right to withdraw or deny such consent at any time. Except in certain circumstances, the customer has the right to 30 days notice before transfer or discharge from the center. A customer has the right to self-discharge him or herself from the center and provide, if desired, a written release of the center from responsibility. The customer has the right to, and the facility must promote and facilitate, customer self-determination through the support of customer choice. What's the best thing you can do to ensure the safety of you, your peers, and your customers? If you see something, say something. And remember, mission matters.